Twitter, live on the Instagram, and looks like I am live on the Facebook. Hello, everybody. Recording live from somewhere. This is Zach Couples with episode number 13. Damn, man, it's a lot of the Movement Debrief, where we're going to talk about a lot of cool things today. For example, we're going to talk about the death of the vertical tibia. I'm going to update you cats on my patient who was dealing with sensation loss. And we'll talk about Usain Bolt. I think that's how his name's pronounced, Mr. Bolt, who just recently retired. Congratulations to him. And we'll talk about a patient that I'm really struggling with. And it's not for, we'll talk about that, man. It's going to be a long one, I think, tonight. But that's what's in store for today. Before we get into the debrief, a little bit of housekeeping. Did you guys see my blog this past week? So this past week's blog entailed a bunch of links to a bunch of the things that are kind of tripping my trigger as of right now. So I'm kind of, my learning focus overall has been, I've been trying to learn a lot about nutrition, a lot about functional medicine, these types of things, because I think it's just damn fascinating. And so there's a lot of stuff with that. I've been trying to learn a little bit about like personal finance and just trying to get that hole in my game a little bit better, because I think, I've been doing a lot of Con Ed courses, and that's not great for the bank account. And so I'm trying to streamline that. So there's a lot of links for that. But please check it out. There's a lot of good people on there, like Rhonda Patrick, #Bay. She's just putting out incredible content, and you guys should really check out some of the stuff she's doing. I linked a ton of my favorite stuff to her and that. There's a lot of other things. Other housekeeping, this is not related to me whatsoever. Actually, before I go into that, but if you guys want those links, I release them weekly. So you'll get them ahead of the game. If you sign up for my newsletter at zachcouples.com, you will get them every Friday, so you can go through them over the course of your weekend. The other housekeeping event. This is probably old, but if you guys are hip-hop fans, Raekwon the Chef, he put out a new album, and it is straight up fire. Like, you cats got to listen to that. Go to, I forget what the hell it's called, but go to Spotify, go to his recent album, and just listen, because that shit is unbelievable. Raekwon is the man, so I got mad props for Raekwon. I know that has absolutely nothing to do with movement debriefing, but I got after it in the gym because of Raekwon, so thank you. Give a shout out to him. Other housekeeping that's actually probably a little bit more pertinent is my daddy Pops, Bill Hartman. He's releasing a book August 22nd on Amazon. It's called All Gain, No Pain. I have read it because I did the editing, and I was had the honor of doing the foreword for the book. And it was this book's awesome. It's a game changer. It's generally meant for people who want to get out of training once they or get into training once they finish rehabilitation or physical therapy, and it's a gold standard. He put out a phenomenal book. So August 22nd, I'm going to link the snot out of this. I'll probably write a little book summary on it. But you guys got to check that out. It's going to be killer. Also, another person to check out RobertsonTrainingSystems.com. My big dog, Mike Robertson, he gave me the honor of of putting 2 guest posts out next couple weeks. So if you guys are into basketball, you may want to check those out. And check out his website, because his squat video, or his deadlift and squat posts, those were inspiring for a lot of the posts that I did. So please check out his stuff, RobertsonTrainingSystems.com. That might have been the longest housekeeping ever. So let's dive into the debrief. First thing, I want to update you guys on the patient who I talked about last week's debrief, where I was kind of struggling with restoring sensation on him, because he. So for those who didn't tune into the debrief, why didn't you? Seeing this guy who he had back surgery 2 years ago and is dealing with a little bit of sensory loss in his right leg that's been going on since the surgery, and I'm seeing him predominantly for that, because we kind of cleared up all his pain, and he's not really having any limitations. I'll leave it at that, because I'm not going to go on a tirade. I'm going to go on a tirade later. And so a lot of you people who are listening in put out some great suggestions, and I tried some of them. and I tried traction in various forms, and it was kind of cool because we got just a little slight improvement in sharp sensation, which was nice to see. Within treatment, which was cool. But the real big game changer, and like this was remarkable, like I was kind of, whoa, I can't believe this actually worked. I told the guy, I'm like, man, I didn't know if this was going to work, but it was awesome. We did some neurodynamics. So what I had him do, his sensory loss is along the fibular nerve distribution, or the superficial fibular nerve, which, for those peeps who aren't in the know, it's like right along there-ish, but on his right side. Hope y'all can see me. And so I did some slidus, which, let me see if I can reorient the camera without dropping everything in sight. There we go. Okay. So basically I just had him slouch, kick his leg into plantar flexion inversion, move the head up. We did that 20 times. We did some tensioners where he kept the head down. And what in theory those are intending to do is create a little mobility in the nerve, because as we know, the nervous system is connected, all 45 miles of nerves. And so if you tug on one end, that's going to create movement on the opposite end. And so we did some things. Sliders do this, where the head's going up with the leg, and then tensioners kind of pull things or elongate them so that the circumference of the nerve is reduced. And so that actually creates a little bit of space around where the the neural container, which would be all the tissues that surround the nerve, right? And so we did that, and like immediate improvement in sensation, like was feeling a ton of sharp, was feeling some dull. We got a little bit improvements in like 2-point discrimination, which is, can you differentiate 2 versus 1 point over that region? It was pretty remarkable. So if you have sensory loss, again, this is an isolated patient, so take it for what it's worth. Hashtag N of 1. You may think about incorporating neurodynamics over the region. I think that's probably, it's something for me that I kind of go back and forth with doing, because sometimes, restoring movement variability in all 3 planes in a joint is immensely helpful, but sometimes you got to create a little mobilization throughout the nerve. And is that what we're really doing? Who knows? I know the research for right now for using that intervention is kind of sparse, actually, but it seemed to work for this cat. So if you got sensory loss, you may consider traction, because that seemed to help a little bit, but I think neurodynamics, man, there's something to them. Something to that David Butler and his stuff. So if you want like some good resources on that concept, I would definitely check out David Butler's book, Mobilization of the Nervous System. No, the Sensitive Nervous System. His course is the Mobilization of the Nervous System. Definitely check out his book, The Sensitive Nervous System. It's the gold standard resource. Shacklock's book, Clinical Neurodynamics, also very good. I've done notes on my website on both of those books. I think if you want to go to a course, Adrian Lowe does a neurodynamics course, which is really, really good. And NOI has a mobilization of the nervous system, which is pretty good. If I had my pick, I haven't taken both of them. I might gravitate more towards Adrian. I hate to say it. If I'm going to go with mobilization, I feel like Adrian's course gave a little bit more practical tips than the mobilization of the nervous system did. And I think, whereas like for Explain Pain or something like that, NOI might do a bit better job in terms of talking a bit more about the foundational sciences. But I mean, honestly, if you got unlimited bucks, take them both, because I think they're both phenomenal. But it's like if you got to pick one, that's where I would go. So try neurodynamics with your peeps. Okay. Vertical tibia on the squat. I talked a little bit about this in my squatting bar reach deep dive, but I think we need to reinforce this. So I was in the gym in Page, Titanium Fitness. Champ Slim, I see you listening in, so shout out to Titanium Fitness and I'll tell you what, you guys should friend Perry_Slim20. He is the man behind Titanium. But like, it's just an awesome gym, man. It's an awesome gym, especially for a small town. Gives me a lot of time to get after it. So great stuff. But I, occasionally help some peeps out of there. And this one chick had a knee surgery, and actually her third knee surgery in a very short time. Very sad. And her physical therapist is encouraging her to, when she squats, to maintain a vertical tibia at all times. No pushing the knees forward. And I think that's a load of crap. Period. And here's why it's a load of crap. Let me preface this first. Okay, why would someone want to just encourage keeping the tibia vertical? And my thought would be, if you're going to do that, it's because you want to reduce shear forces in the knee, right? So if I push the tibia into anterior translation and the knee goes forward, that may create some shearing forces in the knee. Whereas if I keep a vertical tibia angle, it may better recruit the hamstrings, at least at the proximal portion. And yeah, I mean, it would be the same as like a, something that you would do in the deadlift, where that seems to be a bit more hamstring dominant than quad dominant. Or even if you think about it like a glute ham raise or a Nordic hamstring, the shin stays relatively vertical and it allows for greater hamstring activity. And if you look at the research, adopting a vertical tibia, especially after like an ACL, which this wasn't this most recent chick's surgery, but this chick's most recent surgery. But that was definitely something she had. But people actually adopt a vertical tibia strategy to protect the knee. And I think in the early phases of rehab, before you're introducing some type of squat, I generally get my people deadlifting because for multiple reasons. Check out the deadlift deep dive that I did. But it's a great way to stretch into the posterior hips, allows you kicking in the glutes and hamstrings, and those are critical for protecting the knee in the sense that they minimize anterior tibial translation. But I think it's utter bullshit to cue that in the squat. And here's why I say that is. If you squat correctly, what the goal of it is to be able to change the levels of your torso. And in order to effectively do that without increasing back extension, amongst other things, and to maintain your center of gravity, you have to push your knees forward. And so what I want you guys to think about, and hopefully I can step back and do this, is if I want to maintain the center of mass of either myself or some type of external load, the ideal goal would be to keep the weight in line with the midfoot. So weight is over the shoelaces at all times. Okay? Let's say I'm doing a front squat and I'm cueing a vertical tibia angle. When I sit back and do this move to try to create a vertical tibia angle, one, it's hard, but two, you're going to notice that the weight is going to go a bit more forward here, right? If the front squat bar is here, if I'm doing a back squat, or if I'm doing anything, the weight is going to be ahead of the midfoot. So if I'm here and I'm going to squat down, sorry Facebook, and I got the weight here, you can see that I'm trying to keep a vertical tibia, but what that does is it pushes the weight forward, and I have to overextend my back on the way up. That's not ideal, because what I can't do in that case is I can't maintain wherever the load is, whether it's a bar or whether it's U, which would be the acromion tip. If I'm doing a vertical tibia, you can't change levels effectively to be able to do that. So in order for me to keep that bar path in a straight line, I have to be able to push the knees forward while achieving heel contact. That's not going to create much shear force in the knee if you do it correctly. Because what happens is as I descend into the squat, I'm going to go into a little bit of a posterior pelvic tilt. Just a little bit. I don't want excessive, right? Because I'm not going to load that. But as I change levels and I push the knees forward, my pelvis tips slightly posteriorly, probably outside of neutral, because we know very well, if you look in the literature, we do get some lumbar flexion with any variation of squat, and concomitantly that's going to lead to some posterior pelvic tilt. But if you do that effectively and you keep heel contact, that posterior tilt is achieved by the hamstrings. The hamstrings prevent excessive anterior tibial translation. So if I got a hamstring tugging me back and I'm pushing the knee forward, I'm not creating that shear force in the knee, because the hamstring is keeping the amount of anterior tibial translation or excessive anterior tibial translation in check. And so pushing the knees forward is what creates a posterior pelvic tilt and allows me for greater descension or descending range of motion in the squat. Because also another thing to consider is if I keep my shins vertical and I can't get that posterior pelvic tilt to allow me to descend into a squat. Now, if I'm doing something weighted, it's going to be that amount, right? Not that. If I'm trying to keep a vertical tibia angle, I am by default, because of the increase in back extension on the way up, going to have increased anterior pelvic tilt. That's going to limit my squat depth, and it's going to recruit more back extensors than it is going to load the legs. So we have to be able to push these forward, like period, because it allows us to effectively change levels. It allows for a greater stretch position or eccentric position for us to drive out of the bottom of the squat from the glutes and the hamstrings. And I would argue that it effectively balances quads and hamstrings a bit more effectively than if you would, say, doing a vertical tibia squat. Because the squat, like people, we need quads. Like I know that we say people are quad dominant, but the quads are still very important, especially when they're in a good position and they're working effectively, because they do provide a little bit of stability from in the knee joint in terms of providing a little bit of compression, right, based on their attachments. They're excellent force generators, especially when I'm doing any type of jumping maneuver or anything explosive knee and hip extension. I mean, they're just a crucial muscle group, and I think that if we induce in our people that we cannot achieve, we must do everything with the vertical tibia, we're doing our people a disservice. Like, do not be afraid to push the knees forward on a squat, assuming you can keep heel contact. When you push the knees forward, you're not diving into excessive posterior pelvic tilt. And most importantly, you're keeping your bar path, whatever bar that is, right over the midfoot. And really the only way you can effectively do those things, or if you can effectively do those three things, that's going to keep your knee in a safe position, and you will be okay pushing those knees forward on a squat. So, push the knees forward, peeps. Trust me. All right. Usain Bolt. So, obviously he retired. Congratulations to him. And there's an article on him recently about the asymmetries that he has present that may or may not have, I think he may have said that he had a scoliosis or something that people argue may have been helpful for his success. And I had someone PM me or DM me, slide into my DMs. Not like that though. On Instagram, I won't say who it is because I'm not going to try to incriminate the guy. And it's not that I'm incriminating him anyways, because I mean he brought a valid question, and the reason why I'm bringing this up is it's dealing with Usain Bolt and then the concept of PRI. And so what he said roughly was, "Hey Zach, I heard that someone said that PRI would hurt Mr. Bolt if we did it on him, and it might reduce his performance. And I listed some reasons why, which I'm going to talk about that is. So that's like problem one. And then problem two was, well, he had a hamstring strain in 2011 or whatever it was. I mean, it doesn't matter. But the fact is, Mr. Bolt had a hamstring strain. So the crux of this is Usain Bolt is asymmetrical. Would PRI or any type of intervention for that matter hurt him? And what was the third thing? Oh, would it have helped him prevent a hamstring strain? And there are iterations of this. Like I've seen this problem multiple times in the sense that we see some type of professional athlete, this happens to him, or he has this, and perhaps we have some type of intervention that's helped a lot of people, and we all think in our heads that we probably give ourselves too much credit that, oh, if we did that, we may have enhanced his performance or prevented that, or, oh man, I don't want to do that with this guy because if I do that, it's going to destroy him because it's so powerful. First thing is, I honestly think we give ourselves too much credit with this stuff. Like, as impactful as we can be in someone's life, the amount that we spend with people and the amount that we truly influence is very idiosyncratic, and a lot of times it's probably smaller than we think. If we take Usain Bolt in particular, we can say that he has this gross asymmetry, but without context or without working with him, we don't know to what extent that matters in terms of his injuries, in terms of his performance. We don't know. I think it's hard to say whether or not doing any type of intervention from a rehab or performance realm would help or hurt him, because there's just multiple influences in terms of how he's going to respond to anything. I mean, I find it hard to believe that Usain Bolt or any professional athlete is so fragile that a 90-90 hip lift is going to destroy his career, period. I also find it hard to believe that it's going to be the game changer in his career. Because when we're talking about performance to the nth degree, there's multiple influences that go into whether or not someone gets hurt or someone is incredibly successful. In Bolt's case, we don't know what his genetics are. He may be genetically predisposed to developing hamstring injuries. We don't know what his epigenetics are. We don't know what genes were expressed and what genes were not from a multitude of factors. We don't know what his environment was like. We don't know if, based on how he was raised or so on and so forth, or how he developed, in that first year, how those things influence. We don't know if, when Usain Bolt suffered a hamstring tear or trained, this past week, how well he slept. Because we know, based on the research, if you are sleep deprived, that increases your injury risk. We don't know what his training was like. We don't know, and not just from a general physical preparation standpoint, so the things we might do as rehab clinicians or performance and or physical preparation coaches or the gamut or whatever you are. We don't know what he was doing for that. We don't know to the extent that doing those interventions helped him or didn't help him. We don't know what his special physical preparation was like. We don't know what he was doing from a sprint training standpoint in all of those areas. We don't know what his stress levels were like. Perhaps when he tore his hamstring, he got in a fight with one of his girlies, and that increased stress levels enough that he sustained an injury. And we know if you get injured in a stressful scenario like, a 100-meter dash final or an Olympic event, that you're more likely to sustain chronic pain. We also know that, people, when you are sprinting sub 10 seconds, that is an incredible stress to the body. Chris, right now I'm talking about Usain Bolt, and would, some of the interventions that we do as rehab clinicians or performance individuals, would that help him or hurt him, essentially? So I guess what I'm saying is, with all of the factors I've listed, and that's just some of them. There's multitudes of other places we could take this. We could take this to nutrition. We could take this to a lot of things. You know, did he sleep well? Did his preparation match how it normally is? Did whatever. The point being is that there are so many factors that go into whether we get hurt or not, whether we perform at the highest level or not, whether we get an autoimmune disease or not, whether we get injured, whether we're healthy or not, whether we're happy or not. It's just, we are such complex creatures, and there's so many influences that go into any one output or thing that happens in our lives, that to say that this small intervention, whether it's PRI, whether it's DNS, whether it's slapping peanut butter on their knees, I don't care what you do, whether it's a friggin' deadlift, whether it's squatting with a vertical tibia, these are such small variables in the grand scheme of things that we truly don't know to what extent it's going to impact someone. And we have to be okay with that uncertainty. And we have to be okay with this complexity. And the most important thing that we have to be concerned with, instead of waxing poetic about whether X, Y, or Z is helpful or harmful, is what is your outcome? And you don't know what that's going to be until you alter some type of variable. And maybe in Bolt's case, that is doing something that's PRI oriented, or maybe it's not. Maybe it's we needed to change something else, given what we think may be potential deficits, or might be rate limiting steps for meeting his goals, which is being the fastest man in the world, which he's met multiple times, right? I think that to summarize this, we're dealing with complex people. There's multiple influences that go into what outputs are expressed or not. We really don't know with any intervention what's going to be helpful or harmful until we do it. We have to be okay with that uncertainty. So do I think that PRI is going to help or hurt Usain Bolt? I have no idea. The dude's retired anyway, so who cares? Just kidding. But it's just, having me personally worked with professional athletes, there's a lot of moving parts, man. Like, there's just so many. It's just such a complex environment, and with complex individuals, that you really don't know to what extent anything matters. It's just hard, because we're not doing these things in controlled scenarios. So, can we just put this Usain Bolt being broken by particular rehab interventions, or Tiger Woods should have gotten a better PT, or any iteration of this argument to rest? And let's realize, people, that it's really hard to say that anything would be good or bad, and not even with professional athletes, but with any patient in general, or client that you work with in general, until you're in that scenario working with them. Because even that's going to change things, whether or not they like you or not, right? So just worry about the people you're working with, and instead of waxing poetic, and get better at getting them better, because that's definitely what I'm trying to do, even though I don't always do well with that. So that's Usain Bolt. Last thing, this is I don't know where this part's going to go. I'm going to kind of, and I'm going to rely on you guys a little bit who are listening to help me out with this. But I've mentioned this patient a few times on this debrief, and I'm kind of struggling with them. So I'm not going to go into great detail about what I'm seeing this person for, but the point being is, this woman has had several knee operations. There's a lot of fear avoidance. There's a lot of anxiety, and she's having pain in her knees. And there's a protocol that is to be followed. that she kind of really wants to stick to. And I've talked to the clinicians that she's worked with or that have done her surgery, and they're like, hey, you know what? As long as you stay within the time frames, you can kind of do, your own stuff. And so it's kind of been a big up and down thing with her in the sense that, for a while, initially early on, I was following this protocol to a T. And she was doing better. But we hit a stopgap, and we hit a sticking point where she couldn't do a straight leg raise without it hurting. Right? And based on the protocol, it's like, well, she should be able to do straight leg raises. And she couldn't. And so I veered from the protocol in the sense that I gave her a different variation of the straight leg raise. So I didn't do exactly what was on the protocol, which, again, the physician was cool with. And that helped her quite a bit. Right? And so I'm like, okay, maybe we can do some things that individualize this a bit for her, because she does need individualized care. And so this protocol is not perfect by any means. And I'll give you an example. So, like, one part of this is she's supposed to do squatting and doing split squats, and then it's like go to a single leg deadlift. And she's cool to do that. And but she can't really balance on one leg. And so it's like, okay, if she can single leg deadlift, surely, even though it's not written in the protocol, a double leg deadlift ought to be okay. And so we worked on that. And she's pretty well doing, right? It wasn't any problems. And I tried to do a couple other, things to progress, like the straight leg raise, amongst other things. Trying to stay close to protocol, but also trying to always move forward. And she came back very frustrated today, and because her knee hurt quite a bit. And so the thought always is my knee hurts, I broke something. And so this is something that I'm trying to do a better job with. And I think for the most part I'm doing okay, but for some reason today, maybe it's the ketones talking, because I'm going keto today. But I'm trying to do a better job of taking ownership of when I screw up. And this isn't whether or not I screwed up or not, but regardless of how it happened, right? It's got to be on me, right? Because if I take ownership of the problem, then I can probably do something about it. Because if it's something outside of my control, what the hell am I going to do about it, right? And so she was very frustrated, and I apologized profusely and said, like, look, this is my bad. I own this problem. And I took some measures to ensure that she feels comfortable with whatever we do. And, I guess kind of where we came to a common ground was, I'm going to follow the protocol. I may make some tweaks to it based on how you respond, but it always has to go through her. So I'm trying to give her some ownership in this. And I guess the reason why I'm talking about this is, like, as you guys can see from my rambling that I'm doing right now, is so we have instances where this following things to a straight line is helpful to a point, and then we hit a stopgap, and then it's like, okay, well, if we veer off that, we seem to do better. And then we keep going, and then all of a sudden, maybe I veered off too far, and we hit a stopgap. Right? I think she didn't damage her knee or anything like that, so I had to reassure her that everything was okay. And moreover, by making a tweak to what she was doing, we got a reduction in pain. But it's, and I'll throw this out to everyone who's listening, is like, if you've dealt with these types of individuals before, like, where's the good middle ground? Because I don't know what that is with this person. Because I think if we follow things to a T, she's going to hit a breaking point at some point, and we're not going to progress. Whereas if I veer too far away from that, and we go beyond her conditioning means, or her positional means, or whatever, her fitness levels, what have you, we run into trouble. So I don't know what the answer is. And it's if there's anything that I struggle with in this case is, as much as I preach that failure is good and you learn, and I definitely am learning from this, and you need to own your problems. This is one case where it's just really, really hard for me, and I don't know how to. Granted, I think I did the right things. It's still just as hard for me to know what the right course of action is for this person. And maybe that's okay. Maybe this is exactly what I talked about with Bolt, is that anytime we do any type of intervention, we're dealing with a lot of uncertainty, and we have to determine what risks we're willing to take with our people and what risks we're not willing to take. And I think one thing that I have to do a better job of is when I'm electing to take those risks, or trying to veer off, or trying something new that maybe is out of the established norm, is if I do this, what is the risk to reward ratio? And in a person like this, who has had extensive medical history, has had extensive fear avoidance and anxiety about this problem, maybe it's something where it's a no-risk option. And I'm not convinced that if I follow this protocol to a T, that there's not risk involved there. I'm sorry this is kind of discombobulated, because I think I'm just trying to sort my way through this. Because for some reason today it really got to me. And I don't like when that happens, especially because, I want to be objective about things. I want to take ownership of problems. I want to step back and look at these failures as good learning experiences, because I think these are all things we should be doing. But I guess with me telling you guys this, even a guy like me who preaches these things has a hard time with it. And so if you're having a hard time with failing, if you're having a hard time with taking ownership of stuff, if you're having a hard time with patience or any problems in life, good. You're going to be okay. You got to keep persevering and keep getting after it and keep taking ownership, because it is these struggles like this, it is these proverbial lows that are only going to make you better at all the things you do, whether that's being a great clinician, whether that's being a great physical preparation coach, whether that's being a great parent, whether that's being a great person, whether that's being a great anything. Embrace the struggle. Do the best you can. America Freedom, man. Jocko Couples, I love it. This guy on Instagram just called me Jocko Couples, and I will tell you guys this. There's been 4 books this year that have been incredible influences for me, and one person in particular, Jocko Willink, has been an incredible influence on me. So his book, Extreme Ownership, that's just incredible, and that's something I've tried to liberally employ into my life, and it has done wonders for me on multiple fronts, in the sense that when I screw up, it's okay, because I think that's one thing that I've had a very hard time with my whole life, is failing. It's just, I get this terrible feeling. I hate when I fail. I feel like a screw. I blame it on I put it upon myself that it reflects on me as I'm a bad person, or I suck at this, as opposed to saying, I failed in this instance, putting it as just an action as opposed to myself. So Extreme Ownership by Leif Babin and Jocko Willink, that is a great book. That's one. The other 2 are by Ryan Holiday, and that's The Obstacle is the Way, which I'm too lazy to read all of these Stoic philosophers. Or not that I'm too lazy, but there's just other stuff I want to read.
That's a great book for summarizing a lot of those philosophies. But like from that book, what I got out of it was looking at things from an objective viewpoint and not putting much emotion into things, or at least tempering your emotions. Or as Jocko would say, America Freedom, stifle your emotions, right? Like that was another game changer for me. The other one by him was The Ego is the Enemy, which I think very early on in my career, last year, I definitely had a big ego, and that definitely got in the way of a lot of things. And just another great read. I think like that one just kind of put me in check, and definitely was very humbling for me, and appreciating how having humility and being humble about things, how that just enriches a lot of your experience in life. And the last one is by Mark Manson, and that is The Subtle Art of Not Giving Up. Which, hell, I can say this is my debrief. Subtle Art of Not Giving a Fuck, right? That book is awesome. That just like, you take all of those things, and then when shit hits the fan, it's cool. Like, I think what I learned from that book is to just not sweat things. It's like, that book was great for just learning to accept myself as who I am and accept people as who they are. And it kind of reinforced a lot of the lessons that I learned in the other books. And just like, life is too short to sweat a lot of the small things, because the last chapter is phenomenal because it talks about death and I'm sweating over this patient right now, but hopefully in 100 years from now I'm going to be dead, right? So do I have my night ruined because I failed this patient? And the answer is no, I don't, because it's going to be okay regardless of the outcome. I need to move on because I got shit to do, and I got people to help, and I got other things to do. I got myself to help. So those 4 books, Extreme Ownership, The Obstacles Away, Ego is the Enemy, and Subtle Art of Not Giving a Fuck. Those are 4 great reads. Those have been the most impactful reads of the year. I don't know if anything's going to top them, honestly. You guys should read those books yesterday. So I think we will call that it for tonight. Thank everyone for tuning in and hearing me blab for the last almost 43 minutes. I appreciate all of you guys for listening in. If you want to hear more of me, ZachCouples.com. You guys should subscribe to my newsletter. If you want to get weekend learning goodies every week, if you want an acute to chronic workload calculator, if you want, this is new, if you want a 12-week basketball conditioning program, spoiler alert, that's what I'm talking about on one of Mike Robertson's blog posts, you should sign up for my newsletter. There's that. You guys can also follow me on, that's you, Facebook, facebook.com/ZCouples. You can follow me on that Instagram, Zach, Z-A-C, Couples, C-U-P-P-L-E-S. I post tons of cool stuff. I post on the quote board. I post my hiking pictures, a lot of other random things. You can also follow me on Twitter. That's you guys. Twitter handle is ZCouples. What do I do on Twitter? Sometimes I throw out like random things that some people might find profound. I don't know. Maybe not. Sometimes I just tweet what's on my mind when I don't have, when I can't make a blog post out of it or something like that. Hopefully I can spend a bit more time on Twitter. But, yeah, that's it, guys. Otherwise, you guys stay classy, keep it real, but not to the extent where things go wrong. Stay hungry, keep learning, keep moving, keep getting better, and I'll see you guys next week. Deuces.